Well, hey there, everyone. It is Marion, and I'm so happy to be with you today. It is Monday Moves with Marion, and we are doing a little bit of a different format today. We will be doing a seminar style format where I am going to be training you on movement with walking and why it is so important to make sure that your shoulders are moving properly, especially for breast cancer patients. Because I am not coming to you live today on video, I just want to take a moment to introduce myself. I am Marion Barnick, a registered kinesiologist and cancer movement therapist. I absolutely love what I do, which is teaching breast cancer patients how to move well, and that brings the benefits physically, mentally, and emotionally so you can kickstart the next chapter of your life. So let's talk walking. Is there a proper way to walk? You don't even think about it. We get up, we move around, this is how we move, so we don't think about walking until, well, of course, there's something that bugs us and we're having problems with it. So if you consider all of the sneaker sales, if you consider what people pay for orthotics, all the different types of treadmills that are out there, all to help us walk properly. But when we don't, that's when we start shelling out the money for knee braces and things for our hips and ankle supports because there absolutely is a proper way to walk. So you might have heard about gait analysis or someone having your gait checked or taking a look at how you're moving. All that means is how we walk. Gait is really about how we are moving our feet one in front of the other and how we propel ourselves to get from one position or to get from one place to another. Of course, we know it as an excellent form of exercise. And the stride that people talk about is actually the position that we put one foot in front of the next, and as we take one step, that is our stride. And the stride can be different for each person. We have our unique way of moving, and that is what we need to look at when we're analyzing how we walk. So I've broken this down into 4 little steps to teach you the easy peasy way of learning what walking is all about. Now, as I told you, this is super important for breast cancer patients, and you're going to say why. Well, I will tell you why as we get through this seminar, but one of the things that I want to bring to your attention is the first thing that surgeons and oncologists, and you can see it all over the websites that people are saying is cancer patients need to get out and move, and they need 150 minutes of exercise per week. And the best way to do that and the easiest way to do that is by walking. And you know what? Walking may be an easy thing to do, but for breast cancer patients, when you're talking about going through treatment, when you're talking about getting yourself motivated and moving, first of all, that 150 minutes a week can seem extremely daunting. And what I'm looking at today and I want to talk to you about is if you're not walking properly, you may find yourself in some serious risks for injuries and for decreasing what you're doing because it's just too darn hard. So let's take a look at the easy peasy walking lesson so we can become empowered, grab that knowledge, and we know what we're doing to literally move forward. So this first thing is the heel strike. This is your first point of contact with the ground, and it is made with the heel of your foot that's moving forward. First step, done, easy. Next phase is the stance phase. And that is that foot that you've planted on the ground, and it is what's holding you up as you're moving forward with, next phase, the other leg. It's swinging through. So as one leg is in stance phase, holding you up, that's when you're swinging that other leg around and in front of the stance leg. And then that last part of the walking is the toe off. That is the last part of your foot to leave the ground. So you're going to hit with your heel, you're going to hold up your weight, swing the other leg through, and then the toe comes off the ground. Now, as you recall, this is a seminar on talking about how shoulder movement is affecting your walking. So it would be really silly of me not to talk about other parts of your body that are involved in walking, because it is not just the feet. I think this picture is giving you some idea of what we're doing with our upper body, especially our arms, as we are walking. Our arms are used for balance while we are mobilizing or moving our body with walking. We also use our arms for speed. We know through research that as we move our arms when we're walking, they actually help propel us and we move faster. Our arms are also used to stabilize us as we're moving. Now, this is a picture not showing us walking, but it certainly gives an idea how the position of the arms can help stabilize our body and keep us from falling down. Now, my last point about using the arms while you're walking is that it helps to conserve energy. We know from studies that using your arms when you're walking actually decreases how much energy you're using to move yourself from point A to point B. This is so important for breast cancer patients because when you have fatigue, when you are tired, and when it is difficult just to get out of bed and get to the bathroom, you are looking at any way you can to conserve energy. So using those arms definitely help. But after breast cancer surgery, that is when it is so difficult to move our arms. This is why I'm coming to you with this seminar, because moving your arms is really important if you're adding walking to your exercise routine. So why do we care about this? Why do we care about walking? Why do we care about how our arms are affecting walking? Well, I'm going to tell you. We care because it is super important to have the proper movement in our arms. It is just vital to have that good range of motion about the shoulders because not just with walking, but it's important for all sorts of activities, especially the ones you love and you want to get back to after surgery. Another reason is having your mobility in your arms and helping you with your walking decreases your risk of falling. There are issues sometimes with certain chemo agents that cause peripheral neuropathy. So if there is loss of sensation in your lower extremities, in your feet, it is important for you to make sure that your arms are moving properly to keep you in balance. We're also going to decrease our risk of injury. So if our arms are moving properly, that means that we are walking properly and those ankles, those hips, and those knees are going to stay injury-free. We also want to look at progressing. I mean, that is the whole goal and getting back to those activities that you love. So once you start with your walking program, you want a faster pace, you want better results, you want improved health, and therefore the arm movement, decreased risk of injuries. See how they're all adding up? It is something really important because last but not least, the exercise benefits from walking can lead to so many other activities. It's progressing you not only to decrease the symptoms while you go through cancer treatment, whether it's chemotherapy, whether it's radiation, whether it's to get your mobility back after breast cancer surgery, but adding a good exercise routine decreases your risk of recurrence. So if you're not believing me that arms are a vital part of walking, take a look. We can look at video after video or look out the window or stand in front of a mirror and just try to even walk in place. Those arms are moving, and if they're not, then you are not getting the best resource of walking as an exercise for yourself. We want those arms to move. We went through the reasons that we care about this, and you can see without even thinking about it, those arms should be moving. Now, even though we don't think about it, there is a certain way we should move our arms to get the maximal benefit. And what happens after breast cancer surgery is that tightness through the chest and the shoulder mobility that can decrease. It's going to have an effect on how you move your arms when you walk. So this is something that I would love to review with you and let you know not only how you should be moving your arms, but to look at what can happen if you're not moving them properly. It is vitally important, and I want you to have that knowledge. So we went through our easy peasy steps in walking, and we looked at how the feet were moving and how the legs move as we're walking. So we're going to add the arms, and there's only two things that we have to look at. One is that heel strike. So that is that first position with our foot when we are hitting our heel onto the ground. So when your left heel is forward, your right arm is forward. It's the opposite. It's called a reciprocal gait pattern. And what that means is as the left foot is forward, the right arm is forward. Now, the last part of walking we know for the lower extremities is that toe off. So when we look to the right here, we can see when that left toe is at the back, our right arm is at the back. So again, that same reciprocal pattern. So left heel forward, right arm forward, left foot back, and we've got the right arm back. And you don't even have to think about it when you're doing it. When you're walking, your arms will naturally move in that position. Trust me, but give it a try yourself. Now, I did say trust me, but I want to go through a few studies because I want you to know how important it is to take a look at how your arms are moving when you're walking. So if we look at a study that was done at Harvard, what they said the arms were important for when you're walking is to cancel out the movements in the lower limbs. So what happens is our body can rotate as we're walking, and our arms really work to stabilize our body from the positions of our lower limbs or our legs. Why this is important? Well, those are one of those points that we talked about with why we need to care about this is to maintain our balance. So if we wobble on something, if we step on something, if we're walking up a hill or on ground that's uneven, our arms are going to help to cancel out those movements in the lower limbs that may throw us off balance and could put us at risk. Another study that was done was looking at arm swing as we age and also looking at the velocity or the speed of the arm swing. So what they found was the faster you want to go, the greater the amount of swing with your arms. So that is absolutely important as we want to progress with our exercise, as we want to get back to the things that we love. The faster you want to walk, the more we're going to have that arm swing. So if those shoulders are not moving, if those pecs are tight, well, that is the first place to start because we want to amp up our walking and we want to get on with our exercise. The other thing that they found is as you get older, that arm swing decreases. So that is definitely something to take into consideration at a certain age. And I'm not pointing any fingers at any age in particular, but what I'm saying is getting back that movement in the shoulders and the arms is really important as we age, not only for the shoulders, but also for our walking. And one of the things that I find really important is when we decrease our arm swing, when we're not using our arms properly, we are putting the muscles and the joints in our lower extremities, in our hips and our legs at risk. And that's what this study found, is that when people are not using their arms when they're walking, they are increasing the firing. In this case, they found that the muscle, the gluteus medius, or the side muscle of your tush, definitely had increased firing, which means it's working way, way more than if you were using your arms. So you might think, great, I want to use my tush when I'm walking. Absolutely. But what I'm saying is, if you're not using all the muscles properly and in sequence, you are going to increase that risk of injury. So if we look at how that glute medius works and we look at the pulling on the hips, that may not be something that you want to have happen with each and every step that you're taking in your walking program. Now, one last little point that I found was interesting when I was looking through studies was a study actually done with stroke patients. So during rehabilitation of patients getting back after they've had a stroke, what they found was improved and better muscle activation for walking, so in the lower extremities through the legs, when patients were learning how to swing their arms properly. So again, this really substantiates how important that arm swing is. If this is happening with stroke patients and they are getting the arm swings back and they are getting their legs moving better and they're activating their muscles better, think about this from your standpoint. Coming back from breast cancer surgery, getting the shoulders mobilized, getting that spine in the upper back standing upright and getting things moving, it is going to make your walking so much easier and mentally and physically feel so much better. But unfortunately, there are things that happen when we mess this up. And this is why I think it's important for me to come to you today and let you know. We need to look at what happens when those arms are not moving well, so we realize how important it is to get this right. I always get consent from the surgeon prior to working with a patient. And this is for, first of all, because of the breast cancer surgery and breast cancer diagnosis, I want to make sure that the patient is stable and that there may be some unique instances that the surgeon may have to pass along some information to me. But there's also other areas that we can be concerned about and that we should be concerned about, and it could be previous diagnoses. So when we're talking about walking and we're talking about shoulder movements and problems that can occur, patients may say, well, what came first? Is it my shoulder problems? Is it my arm movement? Or did my hips cause my tight chest muscles? You know what? What came first really isn't important. What we're looking at is making sure we're moving properly now. So let's take a look at a normal arm swing. We've got the side view here of this young lady on the treadmill. And as you can see, first of all, she is standing up nice and straight. We can see a nice curve in the low back. We can see the arms at the sides, and they are swinging forward and back, and she is maintaining that nice upright position. Now I want you to take a look at this walking action. First of all, I want you to compare the way this patient is walking compared to the young girl on the previous slide. So we had a pace on the previous slide that you could sort of count out 1, 2, 1, 2, and we were even between strides between the right and the left. Are you seeing that here? Are you seeing that evenness between the right and the left sides? So did you see the problems in the previous video? Could you point them out? Could you see what was going on? So let's take a look. I've cut just a couple still pictures here to look at. So let's look at the one on the left. As we can see, the arm on the right side is right down to the side. But where's the left arm? We cannot see it. And when you're looking from the back of someone walking, you need to see those arms on the side. You want to see them swinging forward and back, not across the body. And there's the problem right there. That left arm is swinging in front of the body. We cannot see it. So we know that there's an issue with that shoulder movement and that arm swing. And if we look over to the right, we can see some of the things that may happen. Let's look at the alignment of the hips. Can you see that that right hip is much more elevated than that left? I say much, maybe that's me seeing it, but definitely that right hip is higher. And if you look down to that left foot, is that toe off looking the same as the pictures we looked at earlier in this seminar? Or do you see that that heel is rotated to the inside? That foot's not coming off straight. That's definitely going to be putting some strain on that knee, and those hips definitely have some strain on them as well, just because that arm is swinging onto the inside and not along the sides of the body. And let's continue to take just a quick look at this gait style or this walking style. Again, if we look onto the left, we can see again an angled change in the body. Instead of being upright, leaning way over onto that right side. She's trying to balance out her shoulders. If we look across the shoulders, even at the top, but it's at the expense of leaning through the body. It's not in a straight line. And to compensate, that right arm now is coming in front of the body. We can see as well over on the right side, both arms are at the side. This patient is in that mid stage, so we've got stance on the right side and that swing through is coming through on the left. But look at where that left hip is again, and look at where that left foot is. We've got angle changes and we've got risk factors in the lower body. Now, another area of my practice is actually doing analysis of biomechanics for people who are either into athletics or getting back into a higher level of sports. And this is a video, well, these are actually pictures of video of a gentleman who is training with running. But I thought this would be really interesting to show you some changes in gait as well, because it's exactly what we're talking about. If you look on that left-hand side, we're seeing a stance, gait pattern that's looking fairly normal. Again, we've got that left foot planted, that right leg is swinging through in that phase here of swing through, and we've got the arms at the side. But as that gait continues, and we look at our little frowny face on the right, we can see that right arm is coming across the body, just as we saw in my patient earlier. But how this is affecting this patient's running is looking at that left leg. If you can see that left foot, it's cutting across way in front of the body. It is almost crossing over where the right foot is. And this is causing a huge amount of pain in this left hip for this patient. And that's what we were looking at, is analyzing what was going on with his gait patterns to see what was causing the left hip problems. And sure enough, you can see as that right arm is coming across the body, the left leg is trying to compensate, and it is pulling through the hip as he's trying to keep in balance. So, oh my gosh, I've hit you with all the doom and gloom and all the problems and all the things that are potentially going wrong if we are not getting those shoulders back and moving properly after breast cancer surgery. So, what are we going to do about it? Well, you know what? This is what we're going to do. We are going to train those arms to stay at the sides and to move properly in a forward and back reciprocal pattern as we walk. Now you can see with my patient here, we've got weights in her hands as she's moving. She's at the level where we can do this. Now again, she's not, quote, lifting the weights. We're not doing strength training, but she's using them as balance and support to retrain herself in the proper movement of her arms. So when we have the weights at the side and they are pulling down a little bit on the arms and reminding her of where they should be, it's helping her gait pattern. As we can see, she is moving a lot better with this than she was when she was walking without those weights. Now, sometimes you just don't know what to do, and you're wondering and you're thinking, wow, I can't look at my own gait. I'm not going out walking. I don't know what's going on, but I know my shoulders are feeling tight. My pecs are tight. I'm getting some hip pain, maybe some knee pain. I know for sure I'm not hitting that 150 minutes that somebody told me I had to do. So we need to get some help here. And that is why I've put together a 5-day challenge. This is just for breast cancer patients, and this is something you can do right after surgery, of course, with the consent of your surgeon. But what I'm putting together for the start of September is a private group of breast cancer patients who are really looking to level up, to become empowered, and to say, you know what, I want to get back. I want this next chapter of my life to be filled with as much as I can do, and that is exactly what I want to do. I want to help you through a 5-day challenge where we are going to go into the online rehab classroom together and take a look each day at new movements, new strategies, and get you back to moving properly with the arms, so we know that it's going to help you with all other aspects. So I would love you to be in my group. I would love for you to sign up. And if you look at the link at the bottom, I want you to hit that. I want you to sign up for our 5-day challenge. I will be sending out all that information. But think about it. This is September. Let's get going. You've got a couple weeks to get everything in gear. But what's stopping you? Truly. Let's get moving. Let's get that education and that knowledge flowing. Let's feel empowered, and I would love to help you. So hit the link below, sign up, and join me in my private group for the 5-day challenge. I absolutely hope that you found this inspiring, and I hope you found it informative, and I hope that it has motivated you to get moving and to ask some questions and to think about what you're doing when you're out there walking, or to think about getting off the couch when you are ready, when you've got consent, and get your butt moving and get that exercise going. It is so important. It is so vital. There are so many benefits for breast cancer patients with exercise to get yourself healthy. But if you have questions, if you're not sure, if you are fearful or overwhelmed in any way, I love to chat. Send me an email. We can set up a Zoom call. We can talk specifically about what's going on in your life and what's stopping you from the exercise that I would love to see you doing. And again, this is something in our 5-day challenge that we'll be doing as well, is setting up some private Zoom calls, talking one-on-one, and going through some of your unique challenges. So please send me an email and let's chat and have an awesome day. Thanks for staying tuned to Monday Moves with Marian.